Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. In Maine, the number of people testing positive continues to increase. The number of people requiring hospitalization continues to increase, and the number of people dying continues to increase. On the flip side, the number of people vaccinated continues to increase. This pandemic continues to be very dynamic with new information and policy changes coming at us fast and furious. Our intent is to help you wrap your head around what we are now, where we are now. Today, we'll get an update on the latest COVID-19 information, explore employee mental health with a focus on feelings of loneliness, and we'll put substance use and abuse out in the open. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Dr. Jim Jarvis, Director of Clinical Education and Incident Command Section Chief at Northern Light Health, Angela Felicia, Director of the Health Life Resources Program at Northern Light Acadia Hospital, Jacqueline Sear, from Adult Outpatient Services at Northern Light Acadia Hospital. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply to your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following our hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Let's get started. Our panelists will share useful information from their areas of expertise, and then we will have questions and answers. First up is Dr. Jarvis, who will provide the latest information on COVID-19. Dr. Jarvis?
Thank you, Ed. And as you stated very eloquently, it really is a mixed bag of information, both good and bad. If we see that the latest numbers in our state, we continue to see an increase in the number of individuals who are positive for COVID-19. We have about a state of those that are being hospitalized, with an interesting shift. A few weeks ago, the majority of those cases were north of Augusta, particularly highlighted in Penobscot County, but now that's shifted back again to the southern and central regions of the state. We don't exactly know why that has been happening, and it just continues to elude us how this virus just works differently than other viruses. And then, of course, sorrowfully, we continue to see the death toll rise both here in the state of Maine, in the country, and around the world. Next slide, please. We get questions a lot about testing, and we've been hearing from employees that their employers are asking individuals who have tested positive to then get a negative test prior to returning to work. We've talked about this in the past, but it's always a good reason to kind of go over things again, that we do not recommend retesting after somebody has been positive. And the reason being is that the part of the virus that is detected in those tests can remain floating in our bloodstream and in our nose for up to 90 days after you've completely recovered from the virus. So having that retest may be reassuring if it's negative, but if it's positive, it really has no value whatsoever. We continue to recommend that people follow the CDC guidelines as far as return to work based on a symptom approach rather than a testing approach. And if you remember, for most individuals, that means that 10 days after they have their symptoms start or their test was positive, whichever comes later, that they have all but recovered from those symptoms and have been afebrile off of an antipyretic or anti-fever medicine like Tylenol or Motrin for 24 hours, then it's safe for them to return to work because we no longer consider them infectious. Next slide, please. Let's talk about the big news of the day, which is vaccinations. We are delighted that we have vaccine to help protect us against this devastating pandemic. However, we do not have enough vaccine at this time to vaccinate everybody. So here in the state of Maine, here's where we are at. In the state of Maine, we continue to vaccinate healthcare workers. We know that they are critical to keeping everyone in the state of Maine safe, healthy, and responding to whatever acute occurrence occurs. And so with that, we continue to vaccinate them. To date, we have vaccinated roughly half of the scheduled healthcare workers in the state. So that means we still have a ways to go. In addition to that, we have been vaccinating individuals who either work for or live in long-term care facilities such as nursing homes. That work continues as well. Unfortunately, that has been a slow rollout. Initially, it was under the guidance of a federal contract with 2 large pharmacy companies, and that has not worked out for the state of Maine. And so the state of Maine has pulled those vaccines back and are asking for public and private partnerships to vaccinate those individuals. And then within just the last 2 weeks, the governor added to the list of individuals who should be next on the priority list, individuals who live in the state of Maine who are over the age of 70. As I said, we are a long ways from just vaccinating all of our healthcare workers and first responders, and so it is a slow rollout to those who are over the age of 70. Northern Light Health has been happy to start providing this vaccine this week. We launched our website that gave directions on how people could schedule for clinics, but people need to be patient and understand that the supply of vaccine is extremely limited, and because it is so limited, the number of clinic appointments that we could schedule were only a handful compared to the number of individuals over the age of 70 in the state of Maine. We will continue to release new appointment times each Monday as vaccine becomes available to us. Right now, that is our limiting factor, is the amount of vaccine coming into the state. We do apologize for those who had difficulty navigating the website or who unfortunately got through the process only to find that there was no appointment available. We have improved that website as of today, and we continue to work on ways to improve not just vaccinating those through Northern Light Health, but through any of the organizations that are able to produce vaccines across the state. And I think that's it for my slides.
So Jim, just to be clear now, the numbers that are up on the slide, those are Maine statewide numbers, correct?
That is correct, and that really, the bulk of that is healthcare workers. So we vaccinated a little over 70,000 healthcare workers to date. So that's where we're at.
So we know that there's very high demand, very limited supply, and the health systems in conjunction with Maine CDC are ready to go as the supply expands, correct?
That is correct. In fact, in the state of Maine, we have an incredibly high vaccination rate for the dosages that we have received. In general, the state of Maine, 82% of all vaccine that has been delivered to the state of Maine has been administered to individuals, and Northern Light Health is around 85% of the vaccine. People say, well, why aren't we at 100%? Well, that's because we received a shipment yesterday for a clinic that's going to happen later this week, and so we'll never be at 100% because we're always a little bit ahead of the game. But those numbers are leading the nation, and we're proud of that fact. In fact, our numbers would be higher if we hadn't had that hiccup with that federal contract for vaccinating long-term care facilities, and we're catching up on that as well. The sad news is that it's been 6 weeks since we started, and cumulatively we've only administered 85,000 vaccines. We have 1.4 million people who are estimated to live in the state of Maine. It will be a long haul for us, so please be patient. Your time is coming. Thanks,
Jim. You know, I know we're going to get back to talking about vaccines during the question and answer period for sure. But I'll just take a moment here and point out that Dr. Jarvis really is at the absolute cutting edge of making this all come together and happen. I know there's lots of people involved and lots of people working really hard, but thank you personally for all the work you're doing on that.
Well, thank you, Ed, but I assure you there are hundreds of people who work with me to do this.
I do know that. Yep, and everybody's wearing lots of different hats, so more to follow on that. Thank you. Next up is Angela Felicia. Angela, Angela will speak with us about feelings of loneliness from an employee's viewpoint and what you can do to help. Angela?
Hi, and good morning. Thanks for having me back on this really important forum. I'm happy to be here. I read recently, actually over the weekend, an article in Forbes magazine that indicated mental health and mental health concerns is actually on the rise. I believe the title of the Forbes article was actually around how mental health concerns might in fact be the next pandemic. So encompassed within that, however, is this idea of loneliness too. So just to level set and sort of set the stage, you know, we had obviously many people continue to quarantine or need to quarantine because they've had exposure. Certainly at the beginning of the pandemic in the spring, we had a total shutdown, et cetera, social distancing, masking. This virtual world, we're all virtually here. Those of us who work at Northern Light Health, we might all work at the same organization, but we're all in different locations to really maintain that good physical distancing. So events are either canceled or being held virtually like these webinars are. So all of that can really contribute to loneliness. And next slide, Lainey. So I just want to give a little bit of a definition too of what loneliness is. And loneliness is actually really a feeling, a perception of being alone, of being isolated, of not having good connection. One can actually feel alone and lonely, even if you're surrounded by lots of people. So it's different than just being alone. You can be alone and not in fact feel lonely if you have good connections with loved ones, family, friends, coworkers. So as is true for many things in the world, perception is really everything. And that is especially true when we're thinking about loneliness. You might be in a crowded room pre-pandemic, but still have that sensation of feeling lonely. Next slide. So I also wanted to give us some numbers in regards to loneliness. Many of these numbers are actually related to some survey data that was being conducted prior to the pandemic. So just even noticing that those rates of loneliness across the US have doubled since the 1980s. So this has been an increasing concern as the years have progressed. As in the last census data, we obviously don't have the 2020 census data out yet, but during the last census data in 2010, more than 25% of Americans indicated that they actually live alone. Now, remembering that in and of itself does not mean that someone feels lonely, but that is quite relevant. That's a big shift from the way we used to live with multiple generations of people in our households. And then a full third of Americans reported actually feeling lonely. If we could just go back to that one slide, sorry. I just wanted to point out a couple of risk factors, right? So in the context, particularly now, older adults at greater risk of being lonely, and surveys within the context of the pandemic and in COVID have indicated that people really are having those increasing feelings of loneliness. Thanks for going back. Appreciate that. So again, this loneliness in the context of COVID, we're showing, survey data is showing increases in depression, anxiety, that feeling, that perception of loneliness. And those that are most at risk, older adults, people of color, low income, those in congregate living, those that maybe don't have good access to things like Wi-Fi, computers, virtual options, those individuals in fact are at greater risk for worse health outcomes in general in regards to COVID, but also worse health outcomes in regards to loneliness. Additionally, I would also just like to point out, right, when we're masked, you have a really hard time seeing the entirety of someone's facial expression, right? So we miss seeing people's smiles. If I'm in the grocery store and I'm wearing my mask correctly over my nose, you're really gonna have a hard time seeing if I'm even just smiling at you to say hi and just those general pleasantries. So we're losing a little bit of that as well. And then of course, in the workplace, many folks are working from home. I've been working from home since March, in fact. You have to really be diligent about creating an environment where people can maintain that connection. I have heard the term physical distancing instead of social distancing. I actually really like that term better because we want to be socially connected yet physically distant so that we can maintain the safety. You know, certainly it is harder to connect with people virtually, but it is possible to do that with just a little bit more mindfulness, a little bit more intentionality. Next slide. So a couple ways that we can help. So again, I mentioned that idea of physical distancing, not social distancing. So being really purposeful about how we maintain connections with friends, families, coworkers. We can actually call people on the phone versus just texting, right? So many of us are used to just sending a text. That's great. If you just want to tell your coworker, you know, hey, I'm going to be a few minutes late. But if you really want to make a connection with people, using your actual voice, FaceTime, some other virtual platform is going to be really important. Having cameras on when you're using the virtual technology is also critically important. Now, I recognize a lot of body language is lost from the neck down, but you can at least see people and have a bit of that interaction that you might have. And being really purposeful, as I've mentioned. So you could schedule for your workplace a virtual happy hour, virtual trivia, game nights, so that you're purposely bringing people together. Also, if possible, hosting staff meetings with cameras on. I will share with the group here that our hospital president at Northern Light Acadia has been hosting a staff meeting for the entire hospital every Thursday. And we get about 100, 200 people on that virtual staff meeting. And I would say upwards of 50% of folks have their cameras on. It's a really nice way to make a connection. So it is possible, in fact, to have a really large staff meeting and really encourage and sort of make that be the norm for your organization of keeping those cameras on. The other thing I would just recommend too is creating and scheduling time for chit chat. So if you've got a meeting pre-pandemic, what had happened in the meeting? As people were sort of trickling into the conference room, there was chit chat. People were asking about the weekend. How was your day? How was your drive in? That sort of thing. So give yourself a few minutes before any kind of staff meeting or get together where you're able to do that. Humans really like that social interaction, and it can go a long way to reducing those feelings of loneliness.
Well,
I think that was
thanks,
it for me.
Angela. Yeah, that is. Well, thank you.
Thank
We
you.
appreciate that. You know, I'll add 2 cents onto that. Just this week, we had our Northern Light Health System CEO and President hold a town hall, and it was capped at 500, unfortunately. I think that's because of the technology that we were using. But the majority of people were on camera, and he very strongly encouraged people to do so. And then we had an interactive question and answer. And that worked really well to reconnect all of us. So
great example.
Well, yeah. Well, thanks, Angela.
Thank you.
Jackie Sear is next up and will offer information on substance use and abuse. And loneliness certainly contributes to this next topic. Jackie?
Good morning. Thank you for having me. What a period of time we've had with everything that's going on in the world. And this has led to people turning to alcohol, comfort food, and other substances to deal with the constant stressors. The most commonly used substances that we see are alcohol, marijuana, prescription opioids, benzodiazepines, stimulants, cocaine. We should also add here nicotine and caffeine. Reasons given for the increased use include coping with stress, relief of boredom, coping with mental health symptoms such as anxiety and depression, that's that self-medicating, recreational reasons, tying into that boredom, to treat pain. Many are sitting and staring at screens for long periods of time and experiencing pain differently. Or it could just be part of their daily routine, but that one drink at dinner is easily becoming multiple. As we're seeing this climb in the use of substances, I encourage people to stop and look at their W's. The 5 W's include, what are you drinking and how much? It's important to note the size, the type, and amount, because as you can see here on the diagram, alcohol content changes based on your beverage of choice. When are you drinking? Is it as soon as you're getting out of work? Is it at lunch? Is it all day? Are you needing that drink to start your morning off? And where? Is there a glass right outside of eyeshot of the computer? And then who are you drinking with? Are you noting that you're drinking more frequently alone? And then why? The sixth W that I like to explore is worry. And is there a pattern that's being established that we need to address a little bit further? Research is showing that there is a growing worry or concern. According to the 2019 National Survey on Drug Use and Health, more than 14 million American adults are suffering from alcohol use disorder or alcoholism. Now, you don't need to carry a diagnosis of alcohol use disorder for drinking to be problematic. Another study conducted by the Rand Corporation in September suggests that Americans are drinking 14% more in response to the pandemic-related stressors. The impacts being seen the greatest in women, whose heavy drinking days have increased by 41% in 2020. Now, let's halt and see if we can figure out your why. So HALT stands for H, are you hungry or hangry? A, are you anxious or angry? L, are you lonely or lazy? Don't like that lazy word, so we'll say bored. T for tired or thirsty. Once you know your why, it's easier to take corrective action. If an individual continues to use a substance despite negative consequences and harm to self, this moves into a use disorder. If the substance is alcohol or benzodiazepines at a moderate or severe use, it's really important to seek medical attention in discontinuing. I encourage everyone to do a self-assessment as to what your own biases are when it comes to substance use. Almost everyone has had some type of exposure or experience that will play into how you react. And knowing this ahead of time, especially in a leadership role, can help aid in how you respond if you have an employee or a staff member who's struggling. It's really important to recognize that there are many things that an individual could be dealing with that can present similarly to substance use, but some of the things to watch for could be increased absences, disappearing unexpectedly, declining job performance, evident financial struggle, regular physical health issues, a decline in personal hygiene and appearance, frequently erratic or unpredictable behavior. And as you start speaking with staff about things, it's important to be open and welcoming in a conversation, asking questions that require a more direct response, such as, how are you feeling? I've noticed that you normally would be doing this, but you haven't recently. What's going on? How can I help? The slide on shame and stigma, there's no room for that. I truly believe that the greatest strength that an individual has and a gift that they can give to you is vulnerability and being able to say, I'm struggling and I need help. Now, as employers, it's important to know not to come at this in a judgmental or accusatory way should you suspect that someone is struggling with substance use. I am by no means an expert in HR or the law, but there are protections in place for individuals that report they are struggling with substance use. So strongly encourage knowing your company's policies around a drug-free workplace and have resources available. A good source of information regarding anything substance related is the SAMHSA website, and that is the Substance Abuse and Mental Health Services Administration. People need to know that they are not alone. Seek a family member, a friend, a colleague, or a health professional. Northern Light Acadia Hospital, we're here, we're ready to help, and if we can't or don't know or have that service here, we usually know who to get you connected to. There are several wonderful community-based programs in our service areas, such as the Barn, Health Equity Alliance. Just depends on what service area you're in. The website that's on here for the Maine.gov is wonderful. We use it all the time. There's lots of resources on there, various groups. They even have yoga. The phone lines also are wonderful. You can call and actually talk to somebody privately, and really excited that you've given me this opportunity to talk about this very important subject. Thank you for having me.
Well, thanks, Jackie. Now, let's focus on your questions. I will group similar questions together so we can address as many questions as possible. And our first question today is for Dr. Jarvis. And I'll put a little bit of a qualifier on this question. You know, it always seemed to me that after one of our holidays, about 4 to 6 weeks later, we'll probably see the effect of people's behavior during those holidays. So here we find ourselves at the beginning of that actually 4 to 7 week window, counting both Christmas and New Year's. So the question is, Dr. Jarvis, is the holiday surge of people getting infected as bad as was anticipated? And then the follow-up question would be, what's our hospital situation in Maine relative to that?
That's a great question, Ed. So I'll start with the second question first. Right now, the hospital situation in the state of Maine is stable. We have about 200 individuals who are hospitalized across our state, and that's been a pretty steady number. The problem is that we've seen that number shift. So a few weeks back, we talked about that Eastern Maine Medical Center had over 50 patients who were positive for COVID-19 admitted to the hospital. This week, they're actually down to less than 20. But we've seen a dramatic shift in the number of individuals who have been hospitalized in the central region, particularly at Central Maine Medical Center and Maine General Medical Center, as well as Maine Medical Center in Portland and York Hospital in York. And so it's been this shift that we can't explain, but the numbers have been steady if we look at the entire state. The issue there is that many of those individuals who were before considered in our active category have actually gone through the entire process that they're no longer considered active disease, so been taken off of that number, but however still require hospitalization, and so they're still taking hospital beds up. The other concern there is really around our own staffing. And what if a large number of our staff were to become infected with the virus? They would not be able to work or do the jobs that we had. So it is a concern for us. We are doing better than most other states. We still have capacity if we need it, but we need to keep that in check at all times.
So I'm going to follow that up, Dr. Jarvis. I too have some insight into what's going on across our state because of our incident command information frequently shared by you. How would you assess the preparation across all of our hospitals statewide in terms of any surge that's in addition to what we're already seeing? You know, how prepared are we for that?
So we are prepared to a degree. There are only so many hospital beds across the state. There's only so many long-term care beds, and there's only so many home health agencies that can assist as we do this. But right now we are meeting that capacity. One thing that we do well in this state is talk to each other on a regular basis. In fact, just this morning alone, I was on a call with the other major health systems in the state and the state of Maine talking about this very issue. We continue to monitor it. Each hospital has its own surge plan, meaning that it affects staffing and beds depending on the number of individuals it needs to serve at any given moment. If you think about it, very early on in the pandemic, we were very much afraid that our 4 major medical centers in the state would be overwhelmed. That didn't happen, in part because our smaller hospitals have been preparing for this as well and have been able to manage patients at their own smaller facilities, even when they're positive for COVID-19. Similarly, our long-term care facilities have been able to manage that population as well. That has kept people out of the hospital in order for our hospitals to continue the critical acute care needs of our communities. Managing people who have heart attacks, managing people who have strokes, complications from their diabetes, pneumonia, traffic accidents, and the like. We are very fortunate in our state that we have had that coordinated care, and we're also fortunate that the overwhelming majority of our citizens have paid attention, worn their mask, not gathered outside their household, and washed their hands frequently.
Mm-hmm. So I certainly take some comfort in knowing how well coordinated the health systems across Maine are, and that there is a surge plan in place that can tier up to a very high level. So that's comforting. Thank you, Dr. Jarvis. Next question is for Angela. What clues can I look for in my employees that would suggest loneliness is a problem? And the qualifier there is everyone seems to say they are fine.
Right. That's a great question. And I actually think Jackie mentioned this in her talk too, is you can just start by shifting the way you check in with folks. So it's a real subtle change in language where instead of asking folks, how you doing? How are ya? You ask people with a little bit more intention, a little bit more purpose, and actually use the word feeling. So how are you feeling? That can help people really be able to express their emotional state and encourages and sort of gives that permission for employees to say, oh, you know what? I'm actually not feeling that great. I'm struggling. Here's what I'm struggling with. Now, certainly no employer probably needs or wants to be the therapist. But if you know what's happening with your employee, then you can make that referral, that connection to either your EAP, to places like Northern Light, Acadia, other resources out there so that you can really help your employee continue to be a good employee for you.
Mm. So that's a good one for me to take away. So instead of asking my team, you know, how are you doing? It's more like, how are you feeling?
Yeah, absolutely. Because most of us as good professional adults, we all know the correct answer to the how you doing today is fine. So we really want to instead encourage people to say, you know, how are you feeling? How can I
Unfortunately,
help
I'm brutally honest, Angela. I always answer tired.
Not everyone as honest as you, Dr. Jarvis.
Well, you know, I'll share with everyone part of my way of dealing with things is humor. So my response to that question is frequently on a scale of 1 to 10, I'm a solid C. So anyway, so thank you, Angela. Jackie, the next question is for you. And this actually plays off very nicely Angela's comment. What are some of the subtle tip-offs that an employee has a substance use problem?
Yeah, I think it's really important to know your employees and kind of their patterns, and that part of, you know, if someone is very set in their routine and you're starting to notice that they're not doing the same things, or there's a gap, or there's a quality shift, that's usually the first sign. And that's when we should be stepping in and asking those questions early instead of waiting for it to build up and then be, oh, geez, we got a problem here. So really being in tune with your staff. And then regular, you know, disruption in their schedule through the day if they're disappearing on you, not signing into their meetings like you would expect them to. The shift in the physical appearance also is an early warning sign.
So actually I have a follow-up question for you, Jackie. And I think you've answered it to some degree, but it may actually allow us to drill down a little bit further. So the question is, if my employee seems off at times, how can I figure out what's going on? You know, and particularly it's probably difficult in a remote work environment more so.
Very much so. And I think that this also plays in a lot to what Angela was speaking about, and recognizing that a lot of things can mimic each other. So again, I know it's drilling down into those feelings, and having an environment of being able to have open, honest communications with staff. There's not really an easy answer to that.
So some of those tools that you provided in the slides might be a way to get started with that.
Yes, absolutely. Just start the conversation. Start the conversation, and not being afraid of calling out certain things, you know, to the side, of course, because you never want to do that in front of others. But, you know, geez, Dr. Gilkey, I noticed you've been a little sharp lately. What's going on? What's triggering that? Is there something I can help with? Maybe just targeting certain things to try to drill down, because they're going to give you something, and from that, with your relationship from them, you should be able to drill down a little bit deeper.
Yeah, I'll follow that up, and Angela, I'll bring you into the answer as well. You know, if you think about it from a manager point of view, from a business owner point of view, you know, at times it seems like there's a fine line between holding them responsible and accountable and then overstepping into their personal life too much. You know, comment about that fine line management, if you will. Angela, why don't you start, and then Jackie chime in on that.
Yeah, definitely. I think that's a really good point, right? Because we do want to walk that fine line as employers. That's really important. I think one of the ways that we can really walk that fine line is checking in with folks, doing that kind of connection where Jackie is recommending, saying, gosh, boy, Dr. Gilkey, you know, I noticed usually you're early to meetings. You're early, you're the first one in the Zoom room, but now you're coming in 3, 4, 5 minutes late. What's going on? What's that about? So you can leave it a little bit open-ended and see what the response is, right? So that you give the person a little bit of a room to say what's going on. And then if they tell you they're struggling with something, you can really then connect them. Let me get you connected with EAP because I need you to show up on time to things. So you can actually do a little bit of both. It doesn't have to be an either or, right? You can connect them to the EAP and let them know what the expectation is. The expectation is that you join the meeting right on time, but I want to make sure you're okay. So let me get you to EAP too.
Jackie, anything that you'd add to that?
Absolutely, Angela, that was very nicely put. One of the things that people are very used to from me when we go into a meeting is we do that kind of check-in, but asking about self-care. You know, we're having a lot of stressors coming at us from every direction, and reading people, be like, something feels a little off there. What are you doing for self-care? Fill me in. Oh gosh, well, I had 2 glasses of wine last night. Okay. What about the night before? You know, and then that builds in. Or, you know, what else you got in your bag of tricks for self-care? Have you gone to get your, you know, gone for a hike? Have you spent time outdoors? Giving people ideas on how to do that self-care, even asking the questions, sometimes is just enough before something slides into a big problem to go, oh, they're noticing that I'm not okay. I need to change something.
Yeah, and I would add on to that too, is as the supervisor or manager, right, doing a little bit of modeling of what that looks like, right? So that you could then also say, you know, I've been struggling too. I find this really stressful. You know, I'm feeling a little isolated myself. Here's what I'm doing to take care of myself. You know, here's what I tried and didn't work, but then here's what I have been doing to take care of myself. You know, what are you guys doing to take care of yourselves? We want to make sure that everyone is maintaining their good physical and mental health so that you can continue to be a good employee.
Great. Well, thank you, guys. While you were talking, Angela, you made me think about one of the tools I picked up in the course of my learning for feedback, giving people feedback. And the context of where I learned this was in teaching resident physicians. And this was the 3 levels of feedback. So I'll share it with our group. The first level is to state what the issue is. The second is to state how you feel. And then the third would be the consequences if that doesn't change. So here would be the example you gave. You know, it seems like you're coming in 2-3 minutes late to all of our meetings now. And that makes me feel a little bit angry because I'm trying to really coordinate everybody here, and it just kind of throws us off right from the start. So the consequences are, you know, perhaps maybe I'll ask you to not attend several of these meetings in the future. So some simple things. So what's the issue? How it makes you feel. So we're back to that concept about feeling again, and consequences if the behavior don't change. Okay, so thanks so much. That really took us down an interesting path. Dr. Jarvis, I know there's a lot of interest in vaccinations. I'm going to ask you a couple of more questions, in spite of the fact that you're tired. So, so I hear that the United Kingdom strain will be the predominant strain in the U.S. by March. What's the concern about new strains, and does it mean anything regarding vaccine effectiveness? So a couple of questions buried in there.
Yeah, the concern there is that UK strain that you mentioned is more infectious than the predominant strain we had seen in the earlier parts of the pandemic. Thankfully, it's not more virulent, and I'll define both of those. Infectious is the ability to transmit from one individual to another. Virulence is what kind of disease it causes in the individual who's infected. And so we're not seeing any greater number of hospitalizations or deaths in individuals infected with it. But if it infects more people, we will see more people who are sick and more people who are hospitalized. So that's where the concern is. The good news is that it does not appear to be such a difference between what had been used to design the vaccines versus what that particular variant has. And so that's good news for us. Remember, almost all of the vaccines target the spike protein, or when you see that 3D graphic of the virus, those are the little spindly things that stick out. And there's not enough of a change between the UK variant and the one that had been predominantly around the world beforehand to make that a problem with vaccines. There is some concern about the South African strain that there may be some problems there. Thankfully, that was contained to a few select countries right now, and we will continue to monitor that. But I want people to understand the vaccines that we are giving right now, we feel are incredibly safe and incredibly effective, regardless of which strain happens to be predominant.
So one of the things I picked up on the science of this is to really understand that what viruses do as they infect people and move around the world, they're always changing. They're always trying to see, can they do a better job of transmitting and creating more of themselves? That's what viruses do. So this coronavirus is actually doing what is expected of it. What we don't know is what mutations will actually happen. So if you think about it in the flu vaccine as it circles the globe from year to year, there's actually a considerable amount of mutational change, or what they call genetic shift. And then we make the adjustments based on what we're learning while it's in the southern hemisphere to create the vaccination for the following year in the northern hemisphere. So in a like manner, we're seeing the coronavirus have the genetic shift, but at a much slower rate than what the flu viruses have. So that's a good thing, and we'll just adjust accordingly. So more to follow on that. Thanks for that. I'm going to follow up with another vaccination question and actually combine a couple. So what's the vaccination plan for non-hospital affiliated healthcare workers? So we have, you know, physicians, audiologists, speech language pathologists, physical therapists. Could you comment on what the game plan is for those folks?
Yeah, absolutely, Ed. And we've been vaccinating those folks for several weeks now. The way the Maine State CDC has set this up is that through each type of professions association, so whether that be a medical association, an audiologist association, or the like, they have been given contact numbers for where the closest vaccine clinics will be. We have done this somewhat on an per invitation only process, not because we're hoarding the vaccine, but we don't want to get into a situation where we promise somebody that we're going to have vaccine one day, but then not have the vaccine arrive. And unfortunately, that continues to occur on a fairly regular basis. In fact, it happened today for a clinic that was scheduled, and we had to rush to try to find a way to get vaccine so we didn't have to cancel that clinic. So it's being done on that basis. It has worked very well for us so far. In fact, in many areas, we have already gotten through the majority of healthcare workers, especially in our rural communities. That's a little bit different, though, when we start flipping that to the general population, where because of population density, we're focused more on trying to stand up large-scale facilities in those population density areas. So a little bit difference there. I will say that particularly in the Portland area and in the Bangor area, we are still vaccinating those healthcare workers just because there's just so many of them in those larger areas.
I'm going to keep on this just a little bit longer, Dr. Jarvis. So I've appreciated in past weeks of doing this with you that you do have a crystal ball, but it's very foggy. So having said that, you shared with our team that J&J is going down a pathway of developing a vaccine that may become available for consideration by the FDA in either February or March. It seems like it's a single dose versus the double dose vaccines, and would be the kind of vaccine that would be a bit easier to administer broadly in a mass vaccination for the general public. Now, with that background of information and your foggy crystal ball, when do you think it's going to be offered to the general public, a vaccination, whether it's one of the ones we currently have or one of these new ones?
That's a great question, Ed. So if we look at what happened with both the Pfizer and the Moderna vaccine, about a month after they concluded their own internal data that the vaccines were safe and effective was when they looked at going to the FDA for emergency use authorization, and then that took a couple of weeks for that to occur. So if today Johnson & Johnson were to finish up their internal data collection, we are still looking at several weeks, if not a month, before they apply for emergency use authorization, and then a couple of weeks for that process to work itself out. One of the good news about the Johnson & Johnson vaccine is that, again, it appears to be safe and effective, and its data looks very clean, so it could get faster approval. Unfortunately, they have had some production delays of late, and that may hamper its ability. But as you stated, we believe this is going to be a single shot. And not only that, it uses the more traditional techniques for vaccination, meaning that it won't have to have those ultra cold freezers like in the case of Pfizer, or transport issues like both Pfizer and Moderna have, which may make it more widespread. But those are hopes. And as I keep telling people, hope is not the strategy that I base things on. I base things on what's actually, on the ground right now and today. And so while we are encouraged by that information, we will continue with our current processes as if we will only have Pfizer and Moderna going forward. That's the best way for us to build out a plan and then adjust accordingly when good news happens.
So just tell us quickly, how important is that second dose for the Pfizer and Moderna vaccines?
It is absolutely essential that people get that second dose, and more importantly, that they get it at the time that they are scheduled to get it, for a number of reasons. One, that's because that's the only study data that we have, and so we know that's what works best. We have many vaccines that require booster shots. Just think about your own children and how many times they have had to get, a particular vaccine in a series in order to have full immunity, and that's what's needed. Nobody wants to get partial immunity. You want to get as high immunity as you possibly can, and it's that second dose that boosts our immune system to get us to the levels that really would protect all of us.
So I'm going to try to wrap this up, and I'll ask for your comment as appropriate, Dr. Jarvis. So here we find ourselves that we have limited supply of vaccine coming in. It doesn't look like it's going to massively expand at any time soon. Therefore, we're back to the basics of masking, physical distancing, hand washing, no gatherings of people as the critical tool for us to manage and encourage in all of our environments that we find ourselves doing business. So that's really a critical part of this whole strategy at this point. We're anticipating that we'll be able to expand vaccination broadly over the coming months, not weeks. And that, we're looking into the summer to see some effect. Remember that herd immunity we've talked about at prior sessions requires at least 70% vaccination. And Dr. Jarvis shared about 1.4 million in our state. And we do know that this more infectious UK strain is actually already in our surrounding states. So it probably is already in Maine. We just haven't measured it yet. And we are working on that statewide. So back to basics. Let's not forget that. Well, thank you very much for all that information, Dr. Jarvis. I'm going to switch gears to Angela here. Feelings of loneliness don't seem to happen alone. Frequently, symptoms of depression and anxiety are present. Please help us understand some of those associated symptoms to look for.
Sure, that's a really great question, actually. Because of the pandemic, many of us have sort of been on high alert. We're really vigilant most of the time, where we're not typically used to being so vigilant. So that can actually, in and of itself, create feelings of anxiety, where you might just end up feeling sort of exhausted, worn out, and yet maybe even have trouble sleeping, have appetite changes. I've said this and I've seen this on social media, where people are calling this the COVID-19 pounds, where people are sort of eating their feelings, and Jackie had mentioned that as well. Right, so those signs, some of those symptoms, those can all go hand in hand, and it can end up being a bit of a vicious loop too, right? So if you're not getting good sleep, you're going to be less inclined to reach out and talk to people because you're exhausted, which can make you feel even more depressed, more lonely, creating an environment where you're not sleeping well, and so on, right? So all of these things can be really linked. That's why I think it's super important that we continue to connect with coworkers, family, friends, the people around us, check in with people frequently, and then make sure that those folks get connected to the appropriate services, right? EAP, Northern Light Acadia, for example. I mean, we're doing most of outpatient visits virtually. Many of our other mental health colleagues across the state are doing that as well. There's lots of ways to get connected to make sure that people are doing okay.
Great, great. So really understanding not only loneliness, but depression and anxiety and the various, sometimes pretty common sense tricks of the trade, if you will, about how to deal with that would be very helpful. So let's not overlook the small things that make big differences in people's lives.
Absolutely.
Great. Well, thank you, Angela. I have a question for you, Jackie. My employees' remote work performance is below expectations, and I think it is likely due to drugs and/or alcohol. Do I handle this with a performance improvement plan? I'm concerned that it won't be helpful and seem more punitive than I intend. What can I do to get to the, in quotes, real issues? So that's a kind of a big question, I know. But
that is a big question. I think that clarity is kindness. So when you have an employer-employee dynamic happening, each job has its specifications of what is required. So walking that line of this is the job, this is what we need to see happen. You've been doing a really great job. Again, it's those feelings, Dr. Gilkey, coming in. What's off here? How do we drill that down? Making resources readily available to folks and having conversations around that. So it's totally appropriate to hold people accountable for their job requirements and responsibilities. And then, but on the flip side of that, making sure that there's resources available. We have to be really, really careful, even if we suspect that there's a substance, that we don't call it out, because if we're wrong, that opens up a whole other dynamic that is very uncomfortable to navigate.
So let me just do a quick follow-up on that. Is it reasonable for me to require an employee to get help or risk termination? Should I offer specific options further defining get help? That's a tough one too.
That is a very tough one, right? Because all we can do is offer, we can want the best for everyone and anyone, but if they're not ready to get that help, they're not going to get the help. So again, it's these are the expectations of the job. If we're going to continue in this work relationship, these are the things I need you to be able to accomplish. Here are the resources, my door is open. Also being mindful of what Angela said, as the employer, you don't want to be managing the counseling piece of it as well. So, and after you've provided those things, if you aren't able to meet in the middle of a compromise of what is necessary for the job, then from there, it's kind of that mentor up or mentor out philosophy, so to speak, knowing that you did your best as the employer to provide resources.
Yeah, thanks, Jackie. I see that there was a question that Dr. Jarvis answered in the chat room, so I'll just read it out just in case there's those that are on the phone. At the current rate of vaccination, when would Maine see 75% herd immunity? I'm wondering if summer camps for kids will be able to operate safely. Dr. Jarvis, instead of me reading what you said, yeah, I'll let you paraphrase it.
Yeah, so unfortunately, there's way too many unknowns. The biggest one is that vaccine supply. The estimates are that the minimum number of people we need to vaccinate a day to get to that goal would be 10,000 individuals. That has never been done before in the state of Maine. So that's a monumental task that we are working to overcome. And so with that, I feel that we will still be vaccinating individuals into the fall. And so we just need to be prepared for that. I did say that there is some good news there. The new administration, one of their top priorities will be to increase the amount of vaccine supply, getting it out to states, and not only that, but assisting states in their ability to then put it into people's arms. So hopefully some of that will come to pass and we can do that a little bit better.
Great, thanks. This question is for Angela and Jackie. I'll kind of give you guys a shot at it. I work with students who are struggling. Teachers are very concerned about how to reach them. What is the balance between holding students accountable while meeting their mental health needs? We'll start with Angela, and then Jackie, you look to supplement that. And then we have a 3-minute warning here.
I'll try to be brief.
Sorry.
I'm not known for my brevity. I'll try.
Yeah, sorry.
Yeah, I think that's a great question, right? So kids' mental health is critically important, as well as adult and coworker mental health. So many of the tips that we talked about during this hour actually would also apply to kiddos, right? So purposely generating opportunities for kiddos to connect, even if it's virtual. You know, kids, frankly, are probably better at this virtual environment than us grown-ups. You know, they're digital natives. They're really used to virtual platforms. They're used to technology. So connecting for them virtually is very doable. But any kiddo that you're worried about, you want to make sure that you're reaching out directly to the school social worker, the school guidance counselor, and really getting that social worker, that guidance counselor involved so that they can more reach out directly with that particular student that you're concerned about.
Great. Well, thank you, Angela. Jackie, 2 cents in 1 minute.
Yes. This is the population, the students, the children we need to be looking out for, because we are noting a very rapid increase in substance use in our adolescents. So having conversations, providing education, teaching kids how to deal with their emotions internally versus reaching for that external fix. That's the key. Mindfulness, grounding, and being able to identify what an emotion is huge.
Great. Well, thank you all, and thanks for being under the gun on that. Unfortunately, we've run out of time, and once again, we could go another whole hour with our panel of speakers here. So we've included some additional resources for you at the end of the slides today. Thank you all for joining us, and thank you to our speakers. I hope this hour has been a help to support you, your employees, and our communities to safely manage your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session, which I am personally very excited about, will be on February 4th, and will focus on exposures due to an employee testing positive, vaccination preparation for your business, the stress and anxiety associated with all of this, and the latest on COVID-19. What makes me particularly excited besides content is the way we're going to go about sharing that information with you. More to follow. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a good afternoon.